They say the system protects the living. But what if the system decided you're already dead? My name is Sam Halden. I investigate strange things buried in insurance claims, rejected procedures, vanished patient records, final expenses paid before the first diagnosis. But this case was different, because it began with a dead man calling the hospital that declared him dead. This is case 131. He was declared dead by health insurance. Then he woke up. Chapter 1. The Voicemail. Boston Memorial Hospital, 11:46 p.m., rain tapping like secrets on the window. Dr. Elaine Cross had just finished her rounds in the ICU when her phone buzzed. A voicemail from an unlisted number. She wasn't expecting anything. Most after-hours calls were automated insurance queries or digital record audits. She tapped play. Dr. Cross, it's Nathan. I don't know what's happening. They said I'm dead. I saw the paperwork. But I'm still here. Please, don't let them put me back under. Don't let them take me again. Static. Then silence. Elaine froze. Nathan Rowe had died over a year ago. She remembered the case vividly. A suspected cardiac arrest during recovery from surgery. No family claimed the body. He was declared deceased. Finalized by the hospital. Confirmed by Ardent Mutual Health Insurance. Elaine herself had signed off the digital death report. Her hands trembled as she tapped into the hospital system. Patient ID, NRW, 2305. Status, deceased. Last modified, 6 days ago. By user, system override/all auto finalize. Her mouth went dry. That status wasn't editable by staff. Only the insurance system had access to override death claims. She clicked on the message again, played it 3 times. Same voice, same fear, same man she watched die. By noon the next day, the voicemail had made its way through risk management, legal, and finally landed in the inbox of a man with a reputation for solving things that shouldn't need solving. Sam Halden, private investigator, former insurance fraud analyst. He sat in a diner off Charles Street when he got the call. Mr. Halden, this is Boston Memorial. We have a situation. A man we declared dead just left us a message. And we believe he's still alive. Sam raised an eyebrow. He'd heard a lot in his time. But this was new. Send me everything, he said. And start digging a second grave. We may need it. Chapter 2. A name crossed out. The police didn't take Daniel seriously. After all, it's not a crime to be alive. But it becomes a problem when your social security number is flagged as inactive, and your name is locked in every health system as deceased. Daniel sat in the office of a health benefits case manager. Across the desk, a bored-looking woman flipped through his papers. She double-checked his ID, clicked through her portal, and frowned. Sir, I'm sorry, but according to your insurance record, you're dead. I'm sitting right here. That may be, but your file was closed 13 months ago. Finalized. Digitally archived. There's no appeals process for death. He leaned forward, whispering. Then how am I breathing? That's when the system flagged him again. An alert popped up on the screen. Patient ID anomaly. Escalate to legal risk division. The case manager stiffened. I'm going to have to ask you to leave. By nightfall, Daniel's debit card stopped working. His health portal access was revoked. His driver's license status changed to expired due to death. He sat in his one-room apartment with the lights off, staring at a printed copy of his own obituary. It had been submitted by an automated claims system, with a timestamp 4 minutes after his scheduled outpatient surgery. He didn't remember anything from the moment the anesthesia mask went on. Chapter 3. The Digital Death Certificate. Daniel tracked down the surgeon listed on his certificate, Dr. Conrad Vellon. Problem? Vellon had retired 2 years earlier. and the hospital where the surgery supposedly took place had shut down for asbestos contamination. Still, the document existed. He needed access. With the help of his tech-savvy cousin, Lena, he accessed the state's electronic medical records vault. It took 2 VPNs, a spoof provider credential, and a forged login shell. Inside was his case file. Subject: Daniel Kepler procedure. Appendectomy. Routine outpatient outcome. Code blue. Expired reason. Cardiac arrest. Non-responsive physician. Dr. Velen. Attached: digital death certificate, signed via auto-authentication. He cross-checked the timing. There were inconsistencies. The timestamp of death preceded the start of the surgery. It was pre-filled. Lena narrowed her eyes. They marked you dead before the procedure started. This wasn't a mistake. It was scripted. Daniel felt cold. Why? Lena didn't answer. But she opened a back door on the server and started pulling billing data. Let's see who got paid for your death. Chapter 4. A stranger's signature. The payout trail led to an entity called Concordia Health Analytics, registered in Delaware, operating under a healthcare contractor license, not a hospital. It had received a reimbursement payout of $348,000 under Daniel's claim. Lena looked stunned. You didn't even stay overnight. How did they bill that much? Daniel said nothing. He was staring at the claim description. Biogenetic mapping. Post-mortem neural harvest. Procedure successful. Report: ZLC classification compliant. He whispered the words. What is ZLC? Lena found the signature field. Signed, Dr. M. Hallberg, genetic specialist. He wasn't listed in the original surgery file, but a quick search revealed he was affiliated with a lab shut down after allegations of unauthorized post-mortem experimentation. Daniel had never heard of him. He remembered none of it. But his death had been a transaction, and someone had profited. Chapter 5. The investigator Daniel stood on the cracked pavement of Easton Street, his breath fogging in the chill of a Boston evening. He'd memorized the address. Suite 407, 4th floor, no signage. Just a buzzer with the name E. Cross, private claims. He pressed it. A buzz. The door clicked. Eva Cross opened the door with a slow, assessing gaze. Tall, late 30s, trench coat over jeans, a holster peeking under the hem. Not police, sharper. Her office smelled like old coffee and litigation. You're the dead guy? She asked. Daniel nodded. She gestured him in. Let's see what they buried. Eva reviewed the files Daniel brought. Her brow furrowed at the ZLC mention. Zero liability class, she murmured. I've seen that term in whistleblower packets. Never in real systems. Daniel leaned forward. What does it mean? It means you're flagged as expendable, statistically unprofitable to treat. A shadow classification used in back-end underwriting models, not meant for public eyes. Eva opened her old laptop, patched into a deprecated insurance network known as ARX. She pulled up a secondary claims system. Daniel's file load. D, but with a black bar across it. Flagged. ZLC. Override access required. She scowled. Someone high up doesn't want this reopened. She tapped keys fast. Pulled back secondary logs. Something flickered. A $1.2 million reimbursement. Recipient: Argonaut Biomedical Holdings. Daniel stared. That's not Concordia. Eva nodded. Because Concordia is a shell. Argonaut owns the lab, and 10 others like it. She turned to him. We're not chasing a clerical error. You were deleted on purpose to authorize something illegal. Chapter 6. Someone else cashed in. Over the next 3 days, Eva and Daniel dug deeper. The web of companies was dense, wrapped in firewalled domains and LLCs from tax havens. They traced one of the Concordia labs to an abandoned facility in Dorchester. Inside, wiped drives, dusty cabinets, and an old invoice book. One name caught Daniel's eye. Hallberg M. Eva scanned it. Same guy who signed your post-mortem harvest. They found video logs stored on a hidden drive behind a false bottom drawer. Footage showed sedated patients, their eyes fluttering, strapped into medical chairs. A technician spoke. ZLC candidates stable. Begin neural extraction. Daniel couldn't breathe. Eva uploaded the footage to 3 separate encrypted backups. They're harvesting cognitive patterns, she whispered. Your insurance death let them operate without legal constraint. They checked the original claim processor. A private reinsurance clearinghouse, Forte Reclaim. Eva recognized the name. I worked a fraud case tied to them. They once issued $80 million in payouts, all posthumous. They called a contact, an ex-employee named Glenn, now working freelance in Atlanta. Glenn listened to the story, then said, "You want to know how these guys operate? They run claim simulations on terminal patients. Whoever's trending toward death, they close the file, cache the reinsurance, and delete the record before it's public." Daniel's voice was hoarse. They get paid to predict deaths. And if someone doesn't die, Glenn replied, then the system crashes. And they come looking for you. Chapter 7. Ghost Hospitals. One night later, Eva got a lead. "Daniel," she said, knocking on his motel door. "There's a site. One of the billing addresses we couldn't match. It's listed under a hospital ID, but the hospital doesn't exist." They drove out to Revere, to a building marked Well-Marked Neurological Center. Boarded windows. Rusted signage. But Eva's scanner picked up a faint internal signal. Secure Wi-Fi labeled ZLC_net. They broke in. Inside was a half-functioning lab. For stands. Empty beds. Medical pods like futuristic coffins. One terminal still worked. Barely. Eva connected her drive. Inside were fragmented patient records. Names, conditions, flagged ZLC. All closed in the system. All billed. She found Daniel's name. ZLC 441. Extracted. Neural sync stable. Insurance disbursed. Another line below it. ZLC 442. Pending. Cross. Eva. Eva went pale. Daniel's eyes widened. "They flagged you." She nodded slowly. "We need to leave. Now." As they exited, a black SUV pulled up outside. Voices shouted. Shots rang out. Eva grabbed Daniel's arm. "Back exit." They vanished into the dark alley, hearts pounding, hunted by a system that already claimed them both. Chapter 8. The Claim Farm. The safe house smelled of mold and printer toner. Eva locked 3 bolts behind them before throwing off her jacket. Daniel collapsed onto the old couch, still panting. "I was in that system," she whispered. "I'm next." Daniel sat up, the adrenaline tapering into panic. "How long do we have?" Eva didn't answer. Instead, she grabbed her laptop, booted a cold drive, and accessed a private mirror server she had maintained since her auditor days, built to trace shell companies. She typed in ZLC 442. A match. One document flickered to life. A claim pre-authorization filed 2 weeks ago. Patient, Eva Cross. Procedure, posthumous cognitive transfer. Provider, Welgen Solutions, a lab located in rural Connecticut. She traced the EIN. It looped through 4 other entities before landing at a single parent company, Optinex Group. It owned multiple labs, clinics, and a platform called ReclaimNet. "Daniel," she said slowly, "they've scaled the system. This isn't just about you. Or me. This is an industrial pipeline. They drove 6 hours overnight. The lab was a farmhouse. White siding. Barn and back. A fake dog barked on loop from a speaker at the fence. Eva picked the lock. Inside, humming servers, backup batteries, and rows of filing cabinets disguised as old pantry shelves. No one in sight, but someone had been here recently. Daniel found a paper file labeled Claim Farm 19, Connecticut Note. Inside were names. Hundreds, maybe thousands. Each had 3 tags. ZLC code. Insurance policy terminated. Disbursement status. Completed. Eva flipped pages. Some were teenagers. Some had genetic conditions. Others were terminally ill or undocumented. They're picking people who won't be missed, she said. People on the margins. Then she found a document marked. Replication initiated. Row. Nathan. Neural model uploaded to Sphinx Hub. Daniel froze. Nathan? My roommate. He disappeared after surgery. Eva stared at him. He didn't disappear. He was cloned. Chapter 9. The Blacklist. They returned to Boston and reconnected with Lena, Daniel's cousin, who had cracked the EMR system before. She pulled up a buried registry inside the insurance portal. ARX-level access required, she said, but I found a way in. What they uncovered chilled them. It was a spreadsheet, encrypted, labeled ZLC Master Log. Each row listed a name, insurance ID, algorithm score, and projected cost-to-benefit ratio. A final column read, EOL action, triggered/scheduled/deferred. Daniel found his name, Eva's, Nathan's, then dozens of others. She found a pattern. The algorithm, dubbed LifeWorth, used variables like income, chronic conditions, family support, and AI estimated Kaylee, quality-adjusted life years. Anyone who dropped below a certain threshold was flagged as ZLC. That wasn't the end, it was the start. Flagged patients were then routed through cost recovery programs. Dead or alive, the system submitted posthumous claims, triggered reinsurance payouts, and archived them as legally deceased. Eva whispered, "It's death by spreadsheet." Lena frowned. "There's more." She pointed to a hidden column. Sphinx compatibility score. Daniel's was 92%. What the hell is Sphinx? Eva backed away. We need someone inside. Someone who helped build this. Chapter 10. The Whistleblower. They met him in a parking garage beneath an old law library in Cambridge. The man wore a hoodie and carried a steel briefcase. His name was Rayner, former data architect at Helix Systems, the AI consulting firm that helped design LifeWorth and the ZLC pipeline. "I didn't know," he said. "I built code to optimize resource allocations. I didn't know they'd use it to kill." Eva slid over the documents. They're cloning brains, replacing lives, profiting off declared deaths. He nodded slowly. The Sphinx project. It's real. It's the next phase. They're not just harvesting data. They're building predictive models, digital twins. The idea is to replace the need for the original patient. Daniel's voice shook. "So once they have enough of my brain, I'm obsolete." Rayner opened the briefcase. Inside, a small black cube. "This is a Sphinx node. It simulates neural behavior based on harvested data. You're already in it, Daniel. So is Nathan." Eva asked, "How do we shut it down?" He passed them a chip. "There's a core server, Geneva. If you break it, the whole pyramid collapses." Daniel looked at Eva. "This is bigger than insurance fraud. It's identity extinction," she said. "And it started," Rayner whispered, "with one simple decision. You weren't profitable enough to stay alive." Chapter 11. Dying for Profit. The Geneva server hub was located beneath an office park in Vernier, Switzerland, officially registered as a disaster recovery data center for an international banking firm. In reality, it was the neural AI farm for the Sphinx project. Daniel, Eva and Rainer flew under aliases. Lena stayed behind to coordinate digital exposure if they didn't return. Inside the private plane, Rainer laid out the plan. This server hosts the AI's live memory model. If we extract the memory signature from Sphinx and inject a kill script through root access, it should initiate full rollback. Eva folded her arms. And how do we get past Swiss security, facial scans, and possibly military-grade firewalls? Rainer grinned. We cheat. They posed as a regulatory audit team. Rainer had procured real credentials from a shell agency that had previously approved the server's setup. A bribe had cleared customs. A second bribe had erased their landing. A man named Weiss escorted them through the glass corridors. Cold air. Stainless steel walls. Invisible eyes watching. You have 22 minutes inside, he said. No longer. They reached the server core. Thousands of blinking blue modules in vertical racks. One node glowed differently. White light, soft pulse. Sphinx, Rainer said. Eva plugged in the kill chip. The system fought back immediately. Alarm protocols triggered, files encrypted mid-transfer. But Rainer had built a bypass. He typed feverishly. Daniel watched a monitor. Names flashed. Faces. Data streams simulating voices, personalities, conversations. Then his own. Playback. Kepler, model 6.2. A perfect digital version of Daniel was talking to a synthetic Eva. Terminate trial if original is discovered, it said. Daniel turned away. That's not me. Eva whispered, no. That's what they built from you. The kill script loaded. One by one, the digital twins blinked out. Rows of memory silenced. Sphinx's lights dimmed. Then the alarms shrieked. Security inbound, Weiss said in their earpiece. 5 minutes. Maybe less. Rainer handed Eva the drive. Go. I'll finish it. Daniel hesitated. You'll die in here. Rainer smiled. I helped build it. I'll help end it. They ran. Behind them, the server began to melt, one memory at a time. Chapter 12, The Chase. By the time they reached the surface, the access tunnel had been sealed. Their burner phones buzzed, already flagged. Lena's message was short. Interpol channels breached. You've been exposed. Daniel and Eva ditched their IDs, switched into civilian clothes, and boarded a train towards Zurich. They were quiet for a long time. I saw myself die in that server, Daniel finally said. Eva looked straight ahead. You didn't die. They copied your death. Back in the US, media rumors began swirling. Leaked footage showed cloned neural simulations, billing algorithms with kill codes, and posthumous policy monetization. But the corporations denied everything. Argonaut Holdings issued a statement. No part of our operations involves human replication or unethical data retention. These allegations are based on fabricated media. A week later, the whistleblower Rainer was declared missing, then presumed dead. Eva opened an encrypted email at an internet cafe. It contained only a single line. You've taken their eyes off the pyramid. Now strike the base. It was signed NR, Nathan Rowe. Chapter 13, The Interview. Daniel went public. They arranged an anonymous segment with a major news network. Faces blurred, voices masked, but the documents were real. Eva showed charts, leaked audits, video logs from the Sphinx core. Lena provided live data simulations of policy-based mortality prediction. The anchor asked, "Why do you believe they're doing this?" Daniel answered, "Because in a system based on profit, death can be more valuable than life." The story aired for 36 hours before it was pulled. Then came the threats. Daniel received a funeral bouquet. Eva's car was keyed with the word ghost. Lena's building had a data center fire that wiped half her research. Congress called for an emergency investigation, but the board members of Argonaut simply vanished. No arrests, no formal hearings. Eva said, "We gave them the evidence, but they were ready for the fire. We need to bring the water." Daniel looked at her. "Then let's flood them." Chapter 14, The Flood. A storm settled over D.C. the night they launched it. Daniel, Eva, and Lena sat in a rented townhouse just outside Capitol Hill. The city was asleep. The system was not. "This is it," Lena whispered. "Every claim, every ghost file, every synthetic patient. I've cross-mapped them to hospital discharges, death certificates, and policy payments." Eva leaned over her laptop. "And the kill code. Custom written. Slow leak. If they notice, it'll already be too late." Daniel stood by the window, staring at the rain-streaked glass. "They tried to delete me from the world," he said. "Now we delete their world." At exactly 3 a.m., Lena pressed enter. The upload began. Thousands of policy files flooded secure public channels, whistleblower repositories, blockchain-based data vaults, international media archives, health transparency sites. Then the Sphinx schematic, complete with biometric manipulation logs and synthetic patient flowcharts. Then the directive. Project Osiris, internal memo, level Omega. Patient life cycle value determined by projected policy yield. Candidates flagged posthumously for asset maximization. Do not disclose mortality-based triggers externally. Within minutes, the world had the truth. By dawn, the story trended on every platform. Hashtag ghost insurance. Hashtag dead on paper. Hashtag Daniel is real. Nurses came forward. Coders confessed. Some board members fled to non-extradition countries. Others were quietly arrested. And yet, Argonaut Holdings issued another denial. "We have no knowledge of any Sphinx program. These documents are digital forgeries constructed to undermine private health care." That night, Daniel got a message. From a burner number. "They're not trying to disprove you. They're trying to survive you." NR. Lena leaned back from the screens, exhausted. "They've built this system on shadows. If we want it gone, we burn the root." Eva narrowed her eyes. "Which is?" Lena hesitated, then whispered, "Director Kepler." Daniel turned. "My father." Chapter 15, The Final Claim. The National Health Algorithmic Integrity Center was buried under a decoy university research campus in rural Virginia. Officially, it was shut down in 2019. Unofficially, it was still operational. Eva, Daniel, and Lena went in as cybersecurity consultants. No badges, no names, just firewalls and forged clearance. They were escorted to the deepest level. And there, inside a glass cube, stood a man in his 70s. Hair silver, eyes familiar. "Daniel," he said, "you're supposed to be dead." Daniel froze. "You made me that way." His father, Ellis Kepler, former federal architect of algorithmic reform, was the last remaining piece of Osiris. "I didn't kill you," Ellis said calmly. "I protected you. I made you untraceable. You sold people, Dad. I assigned value. That's what insurance is, risk versus worth." Eva spoke. "You created a system that made death a business model." Ellis turned to her. "And you used it, Agent Cross. You flagged cases. You redacted files." Silence. Lena uploaded the final payload. "Whatever you've done, we just made it public." Ellis didn't blink. "Then you've collapsed the economy." "No," Daniel said. "We gave it a conscience. The kill protocol initiated. Files rewrote themselves. Databases purged." Osiris blinked out. By morning, health insurance companies faced international lawsuits. Sphinx was blacklisted. Argonaut's executives resigned en masse. But more importantly, Hospitals began returning to human-led case reviews. AI systems were paused for audit, and the phrase unclaimed patient was no longer a category, but a warning. Daniel published a book, The Dead Man's Claim, a true story of value, loss, and the fight for identity. Eva became a lead investigator for international patient rights. Lena founded an open-source watchdog group, one that tracks digital erasure across systems. The final message in Daniel's inbox came from an encrypted relay. It had no greeting, no name, just a line. They'll build new systems. But now, people are watching. You were never supposed to see this story. Not in the news. Not in your claim history. And certainly not in your death certificate. But it happened. Maybe not to you. Not yet. But to someone with no family, no coverage, and no one to say, I know this person is alive. Health insurance isn't just about money. It's about data, and what the system decides your life is worth. If this story made you pause, made you check your records, made you think, then share it. Because the system runs best when no one asks questions. But not anymore. You asked. And now you know. This was Case 131. He was declared dead by health insurance. Then he woke up.